Welcome to another episode of Med Madness, where we delve into critical topics for medical students preparing for their exams and future practice. Today, we're focusing on the normal postpartum period, a time of significant physiological changes for new mothers. Understanding these changes is essential not only for managing patients effectively, but also for reassuring them during this transformative period. We'll cover everything from the body's immediate adjustments post-delivery to the routine care necessary to support new mothers through this phase. Next, let's discuss what this condition entails. The postpartum period, immediately following the delivery of the placenta, is marked by a series of natural and expected physiological changes. These changes are primarily driven by hormonal fluctuations. Oxytocin levels, both naturally occurring and sometimes administered, play a crucial role in causing uterine contractions. These contractions help compress the placental bed vessels, reducing the risk of postpartum hemorrhage. As the uterus undergoes involution, it rapidly decreases in size, becoming firm and usually palpable just above or below the umbilicus. This process also generates lochia, which is the shedding of the uterine lining, initially appearing as bloody discharge with small clots. Prolactin levels rise to stimulate breast milk production, while the decrease in estrogen and progesterone levels may lead to postpartum chills and shivering. Next, let's talk about symptoms and clinical presentation. During this period, new mothers might experience transient rigors or chills, which are temporary and typically benign. Peripheral edema is common due to the body's fluid adjustments post-pregnancy. Lochia, starting as lochia rubra, indicates the shedding of the uterine lining and is a normal part of recovery. The uterus itself undergoes contraction and involution, and breast engorgement occurs as milk production ramps up. These symptoms collectively paint a picture of the body adjusting to its non-pregnant state. Moving on to diagnosis. Diagnosing normal postpartum changes involves routine examinations and observations. Healthcare providers will frequently check for uterine atony, ensuring the uterus remains contracted to prevent excessive bleeding. Monitoring lochia is also crucial to ensure it progresses from lochia rubra to serosa and then to alba, indicating normal healing. Additionally, regular assessments of the perineal area and the patient's ability to void are conducted to rule out complications such as infections or urinary retention. Management and treatment. Managing the normal postpartum period involves providing routine care that supports the body's natural healing processes. Rooming in and lactation support are essential, encouraging mother-infant bonding and successful breastfeeding. Serial examinations for uterine atony and bleeding help detect and address any complications early. Perineal care is vital for preventing infections and promoting comfort. Avoiding trial ensures normal urinary function, while pain management helps alleviate discomfort from uterine contractions and perineal trauma. Providing reassurance and education about these normal changes can significantly enhance a new mother's postpartum experience. Case study. Let's consider a brief case study to illustrate these concepts. A 28-year-old first-time mother, hours after delivering a healthy baby, experiences chills and mild shivering. Her uterus is firm and palpable just below the umbilicus, and she has normal lochia rubra. Despite her mild hypothermia, her temperature is 37.9 degrees Celsius, which is within the expected range for postpartum shivering. Her perineal area is intact with no signs of infection, and she is voiding normally. In this case, routine postpartum care, including pain management, perineal hygiene, and lactation support, is all that is needed. Conclusion. In summary, the immediate postpartum period is characterized by significant but normal physiological changes driven by hormonal adjustments. Understanding these changes is crucial for providing effective care and reassurance to new mothers. Early diagnosis and appropriate management can prevent complications and promote a smoother recovery. As always, we encourage you to engage with our pre- and post-podcast quizzes and Anki flashcards to reinforce your understanding and retention of this vital topic. Thank you for joining us on Med Madness. Stay tuned for more insights into essential medical topics.